Brisbane's Donald Simpson Centre is a social hub for seniors. It's here every fortnight that this group of people with dementia and their partners meet for coffee and a chat.
You know, why did we not plan a bit better?
Yeah.
Today, they're talking about the huge reforms to home care, which will start on November 1.
I can understand the problem government's got trying to provide for all us old buggers, you know.
The change that most concerns them is the co-payment scheme, which means they'll have to fork out more in their final years than they could have ever expected.
Apart from our pensions, the government doesn't do anything more than that. So, you know, so if we need to have some help in the home, I feel we're entitled to it.
I think I've contributed a hell of a lot in taxes and that over the years, so I think it's a bit unfair.
Doug Taylor organised today's meeting. He cares for his wife Eileen, who has dementia. When he gets home, he finds she's had a fall.
Let me have a look at that head of yours.
Doesn't feel as sore anymore.
No, so maybe we don't have to take you to the hospital then.
Yay!
Because Eileen has a home care package, she and everyone else already in the system won't be subject to co-payments. But Doug, who's waiting to be assessed for care, will.
Well, I also have good days and bad days. 2 years ago, I was diagnosed with prostate cancer. In the last year, my health has deteriorated even more. Coffee all right?
Good.
Yeah?
The couple get by on a part pension and some savings, but under the new rules, Doug may have to pay up to 80% of some of his fees.
Best cappuccino I've had today. I'm not against not paying anything towards them, but I guess some of the figures that I've heard sounds really extreme. So whatever savings you might have is not going to last very long.
Following the Aged Care Royal Commission and in the lead-up to the 2022 election, aged care reform was one of Labor's key election promises.
We will look after our older Australians. No one held back and no one left behind.
But Labor's plan for co-payments didn't come out of the Royal Commission. Instead, it came from a government task force established in 2023, which proposed a new users' pay system to keep taxpayer costs down.
People who can afford to contribute more to the cost of their care should.
Under the changes, the government will pay for clinical care, like nursing. But for all care and services deemed non-clinical, there'll be a co-payment. For example, pensioners, part pensioners and self-funded retirees will pay between 5% and 50% for things like personal care, showers and help with their medication. If they need help with cooking, cleaning or their laundry, they'll pay between 17.5% and 80% of the fees.
It's really going to impact on those who have not come out of their life with a lot of cash behind them. And that's most of us.
So the Department of Health has published... We showed advocate Beverly Baker from the Older Women's Network a list of indicative prices which providers say they'll be charging under the new scheme. What do you think of them?
These charges are exorbitant. You have a look at these prices. Domestic assistance, $95 an hour. If you just have a look at a simple one like personal care, which is showering, cleaning your teeth, doing things like that, it's $100 an hour that will be charged against your package.
Based on these proposed prices, some part pensioners and all self-funded retirees who need help with personal care like showers would have to pay about $50 an hour. If they needed help with cleaning, cooking or their laundry, they'd be up for $76 an hour. Advocates say it could cause some people to drop basic care like showers, putting their health at risk.
A shower is essential, hygienic care. It is a health issue. If you are not showering regularly, you are at risk of infection, of a whole raft of issues around bodily health. And to charge And to ask people to choose between that and food is really an obscenity.
If you look at the big picture, we're staring down the barrel of a silver tsunami in Australia. Over the next 20 years, the number of people aged 65 years and older is set to double.
Like some advocates, home care provider Luke Trainey has concerns about the co-payments, but says the reforms will provide more and better care.
I worry about the ability of pensioners and older Australians to actually pay some of those co-contributions, which can range to up to 80%. However, there are some positives too. It's an expanding program, which is a great first step on a much longer journey for an ageing population in Australia. And some of the support levels are increasing under support at home as well, which is great for more complex health delivery into the homes of Australians over time.
I heard from both people who are about to receive care under the new Support at Home scheme and from advocates and indeed providers that there are people who are actively thinking about foregoing care because of this cost. That means there are people out there who are thinking, I can't afford to have a shower every day. That is why I'm so focused.
In her first report to government earlier this month, the Inspector General of Aged Care, Natalie Siegel-Brown, said the co-payments are contrary to the Royal Commission's intent.
My concern is with the way in which we have structured co-payments. I believe that it will prejudice those with the lowest income in our society, and that has costs to human rights, fairness, equity.
She believes the reforms could end up costing the government more.
From a financial perspective, I'm not convinced that the small amount it would cost to fund the contributions for people, for example, who are part pensioners or full pensioners, would be offset by the price of some of those people therefore having to move into hospital earlier or even residential aged care earlier.
Neither the new Aged Care Minister Sam Ray nor the Health Minister Mark Butler would do an interview about the co-payments. Minister Ray didn't respond to any of our written questions, but provided a statement saying there'll be financial hardship assistance and the government will monitor the impact and equity of the system.
We have a Royal Commission that says, look, we've looked at the aged care system and these are our recommendations. They ignore them mostly. Hardly any of them came out and they haven't happened. So I get angry with that.
We've swallowed this Kool-Aid that says all baby boomers are rolling in cash and stashing it and stopping younger people getting ahead. We're talking about people who have worked all of their lives, who've scrimped and saved, maybe hang on to their own home, and who are doing it tough on a pension.